The Me Too movement, school shootings, divisiveness in America. Some say the need for therapy and access to mental health is greater than ever. But admitting you need help is often the challenge. And now we know the quality of help you may have been getting depends on your sex. So much so that the American Psychological Association has changed its guidelines for the very first time in more than a decade. The changes say the focus is now treating women with equality, without sexism. Are you thinking what I was thinking? Why wasn't that happening already? I want to bring in mental health professionals to talk about these new guidelines. Joining me now, clinical psychologist Dr. Gardere and psychotherapist Dr. Robi Ludwig. So, Robi, I'll start with you. I mean, if you think your therapist is sexist, don't you just get a new therapist?
I would hope so, because part of successful therapy is feeling like you have the right therapist. And part of that happens in the room. How comfortable do you feel sharing your perspective from an honest place? And if that can't happen, then you probably have the wrong therapist. But this is quite shocking, because I would hope that all therapists have a gender awareness when they're treating women in the room, or men for that matter.
If anyone's going to be the one to do that, it's your therapist, right, Jeff? I mean, is this really an issue? And can these guidelines really change anything? Because if you have a conscious or subconscious mind when it comes to sexism, is this going to change that?
Well, absolutely. We all have implicit biases, and one of the things that we do in medical and psychology schools, graduate schools, is to talk to our students about being aware of those conscious, but especially the unconscious biases that may be impacting the work that we do and taking away from that work. So it's important that we continue to address those issues, get much better at it, and look at how we can, in fact, counsel women in a way that they are seen as fully equal, if not even more than equal, in the sexes with the way that we work with them.
Well, and the reason we talk about this, Robi, it's just so important to have a focus on mental health with everything that's going on in society right now. Do you see anything in these guidelines to change that?
Well, I think it's a reinforcement of hopefully what we already know. We should be aware that there are certain cultural influences and microaggressions, and that a person's position in the world, including their gender and how they identify, influences how they experience themselves in relation to the world, and perhaps even how their various issues get expressed. And education is tremendously helpful, and that's why therapists are licensed and they're required to continue their education, because there's always new information out there that we need to be aware of, that we need to incorporate into our practice. And there are new studies being done all of the time. So hopefully any therapist who's working with patients are listening to their perspective and really weighing that into the overall treatment.
Dr. Gardere, Dr. Robi Ludwig, thanks for being with me. We appreciate it.